watching ABC 15 HD. ABC 15 News at 10 starts now.
Medical care at half the cost, but not in this country. Tonight, ABC 15's Tony Aranaga shows us why many Americans are crossing the border.
Too expensive and too much red tape. That's Valley resident Conchetta Procopio's take on health insurance in America.
Determined that for 6 of us, it was, I would think about $3,000 a month. On an emergency basis, we'd pay a higher deductible.
As it turned out, Procopio needed a hysterectomy, but it was not an emergency.
Was told it would be in and around $30,000.
So she went next door to Mexico.
Surgery in Mexico? I don't think so. Yeah, I was a little reluctant.
A doctor there performed her procedure at a third of the cost.
The hospital foyer looked like, a 5-star hotel. It was immaculate. Staff was amazing and professional. It was not what I expected at all.
Knowing this country's insurance problems won't change anytime soon, this impatient patient blazed a trail like so many others of late. Take a look. According to the American Medical Association, 1 in 7 Americans does not have insurance. And according to another source, more and more Americans each year are turning to other countries for treatment.
We're up to about 60 million people in the U.S. that don't have insurance. There's another 20 or 30 million that have inadequate insurance.
Dr. Curtis Page runs his own practice and helps people in the Valley find doctors over the border. For example,
a doctor who had a lot of training in the United States, who spoke perfect English, who was a teacher in Mexico, he was board certified, he'd written multiple publications, and these are the kind of doctors that we use.
But could there be an ultimate price to pay in gambling with your health in a foreign country?
Over time in this country, we've developed a regulatory system not only for physicians, but also for hospitals that makes certain that the patient comes first. In foreign countries, that's not necessarily the case.
We're not going to tell you, you can't have the surgery, you can't have the surgery. We're going to make sure somebody tells you, that's a qualified physician in your hometown, that yes, you need the surgery and it's safe for you to go before we actually send you.
Are you happy?
Happy and wealthier. Yeah, I got to keep my money.
Procopio adds she would do it again in a heartbeat. She's even comfortable sending her own kids for extreme cases, but her advice?
I'd say to do your homework. Make sure that if you're going to go over there, that you meet up with people that have done the research for you, that can walk you through it. Certainly for peace of mind, I think that's absolutely important.
And like anything, ask lots of questions before you go, because this is definitely one situation where you can't afford to have buyer's remorse. I'm Tony Aranaga, ABC 15 News, your Valley News leader.